So distinguished moderator and panelists, dear participants, colleagues and partners, I take this opportunity to formally welcome you all to our webinar today on a very critical subject of nutrition imperative in the time of COVID-19 and beyond. Heartfelt thanks to Simon, a thought leader, a visionary leader admired by one and all, for having agreed to not only personally contribute as a panelist, but also partner the initiative as co-host. Bayer is the co-host of this webinar, ladies and gentlemen. Along with them, our partners, WFP, UNICEF, and Impact for Nutrition are our supporting partners. And you can make out it is to their might that we could register today over 600 participants, not only from India, but from overseas as well. My special welcome to our distinguished moderator and the panel of speakers who need no introduction. In fact, each one of them is so well known that in fact I can leave it at the name, but in the interest of protocol, I would like to introduce to you first the moderator today, Ms. Geetanjali Master, my colleague from UNICEF, who handle public-private partnership, and she's a specialist in South India. And you will see her own magic today when she will be able to curate the conversation with all the panelists this afternoon. The next with us are Ms. Bishop Prajuli, WFP representative and the country director in India. Let me say, meeting him is always a treat, and whenever I meet him, I get so much of energy. So it is, you will see today also the same energy when he will be able to share his thought and insight with the group. And of course, my own dear Sir or Simon Vaigus, Chief Operating Officer, Crop Science Division of Bayer for India, Bangladesh and Sri Lanka. He is the man who really came forward to stitch this entire conversation of today, presenting this webinar on nutrition imperative in the time of COVID-19 and beyond. And we have equally very important persona from the private sector, who also does not need any introduction. In fact, other day only I met him through this webinar. It was so fascinating to know him. Mr. Piyush Patnaik, he is the Managing Director, Cargill, India. We also will soon be joined by Dr. A. Arunachalam, Assistant Director General, Indian Council of Agriculture Research, who for some reason stuck at the ministry. As soon as he gets free, he will join us soon. So you can imagine now their presence this afternoon truly bear testimony to their deep commitment to SDG 2, Zero Hunger, and SDG 3, Good Health and Well-being. I'm sure most people present today are fully aware of what UN Global Compact is all about, but still a few words about us for the benefit of those who are coming across GCNI perhaps for the first time. Some of you are aware, Global Compact Network India is the local arm of UNGC New York. It is the only UN agency in India that works as a custodian of all the 17 SDG. We are a membership-driven network that works in the areas of advocacy, research, capacity building, and programmatic intervention projects around SDG and 10 global UNGC principles. I must tell you that we are the only agency who have been mandated to work with the private sector or even with the public sector. And we bring that collective strength of all private sector to the table so that we are able to achieve these SDG targets, which are so mammoth. In fact, without support of each and everyone, they cannot be achieved. Now we come to state this subject. The COVID-19 has disrupted our ways of living and working. SDGs and 10 principles are the only ways to respond, restore, rebuild, and resume both of our personal and professional lives. Today, COVID-19 poses an additional threat to the existing issues of food security, poverty, and nutrition, especially in developing countries like India. This pandemic has disrupted a lot of agriculture activities and its supply chain. All of you must be reading in the newspaper or even electronic media. Enough has already been shared. In India, the Rabi crop was just harvested when the country went into a nationwide lockdown. Our farmers struggled to bring the food grains and vegetables to mandis and thereby to the people. Now, with the new set of challenges brought by COVID-19, it is important that the efforts towards providing nutrition to the most vulnerable population not only continues but is also scaled up. I am sure the discussions and interaction during the webinar today will be both engaging and enlightening. I must also share, we recognize this imperative for business because of the fact that our UN Global Compact itself has created a conversation around the world, uniting business for a better world and respond to COVID-19. Along with this series, we have been featuring several webinars, and today we thought the most important were so many people, particularly you're all aware about migration that is happening in India from one city to another is a cause of concern. So with that, I wish you all the best. And before I invite my colleague Gitanjali Master, the Sutradhara of today's program, to take charge of the webinar, I must say that she has been really forthcoming in joining hands together. And today, despite her own challenges at work, she said, yes, I will be happy to drive this agenda. And she is very quickly accept our invitation. I must thank Gitanjali for always coming on board whenever we approach you. And thank you so much, and over to you.
Thank you so much, Kamalji, and a very good afternoon to everybody. Really delighted to moderate this session today. I would request everybody else to be just on mute so that the voice doesn't echo. Thank you again, Kamalji, and just wanting to start this conversation today by hoping that everybody on our esteemed panel, their families, and all in the audience today are safe and healthy and well. These are unprecedented times, and I think the consequences of the coronavirus outbreak has been felt around the world. For many families, as Kamalji was mentioning, this fast evolving situation has meant disrupted livelihoods, family illnesses, potential loss of household incomes, childcare, increased vulnerabilities. And I think really when we talk about vulnerabilities, we talk about the most marginalized. There is a big concern about the impact of COVID-19 pandemic on the nutrition status, therefore, of those most affected, particularly, like I mentioned, the poor and the vulnerable. And I think the current situation aggravates sort of the difficulties many families are facing in terms of access to affordable, healthy diets. We are aware, all of us, that the government of India is acting to protect citizens from corona. COVID-19. These crucial efforts are saving many lives. However, significant action by diverse stakeholders is also critical, and it's needed to protect the nutritional status of the most vulnerable families and individuals across India. Kamalji mentioned the people who are having to leave their homes and move back to places where livelihoods are a concern. And I think we all really need to say that it has to be a collective coming together to address this issue. And while implementing appropriate sort of infection prevention control measures. And that's really the reason why we are here together, to hear, to listen to really important insights coming in the area of nutrition from thought leaders, from people in the private sector, who happen to be one of the key stakeholders, key partners in this entire discourse. So a sincere thanks again for joining us today. This is our esteemed panelists to whom you have all been introduced. I would like to begin the discussion today by requesting each of the panelists to share their insights around the issue of nutrition during COVID-19, just your overarching thoughts before we move into a quick Q&A and discussion. Maybe we could start with Simon. So over to you, Simon.
All right, thank you very much. Namaste and welcome. Thank you to the Global Compact. I think what's interesting in times like these, the call for the United Nations becomes very loud, and we're looking at a global crisis. Still, let me focus a little bit on what we're doing in India, and I think to a certain degree, it is fair to say that India is specifically hard hit from a nutrition perspective when we look at the impact of COVID. Now, Bayer has set itself the vision of hunger for none, health for all. And we did that literally a year ago to revamp a little bit how the organization is positioning itself in the world. And when you think of it, that puts a specific responsibility on us in a situation like this one, where we know it is a health crisis, but even more so in countries like India, we need to make sure that it doesn't become even more so a nutritional crisis. We have committed ourselves to improving the livelihood of 100 million smallholders, and that again is something which is very instrumental to making the food system in India more resilient. We are the country where we are facing, actually, I was looking at the statistics this morning, 30% of the world's malnutrition children, and there was also obviously the topic of stunting comes in, live in India, and this was before the COVID crisis. And when you see also, I was attending a webinar by McKinsey just last week, and they were talking about the impact on specifically smallholder farmers in India due to this crisis. It makes it that much more important that we work together. And I think this is the important part. A single organization, and I would dare to say even a single government, will struggle to really deal with this crisis and overcome this crisis. We all know that economic inequality and access to good food is a challenge, if I may say so, in the best of times in this country already, and it is escalated all the more so today. The lockdown has limited farmer access to markets, and that has risked actually a shift towards government procured crops, or what we are facing or seeing right now is that actually farmers are trying to get out of risk, and they say, let us produce what we can more easily sell. And actually that means that the vegetable production may potentially be impacted, which will lead to higher prices, and therewith you're in the cycle of saying, if we already have an excess problem, if it gets more expensive, then this will be escalated. Now, one example I picked up just this morning is that the state of Telangana, for example, is trying to, steer the growing of crops a little bit more on the basis of data and try to help farmers improve their income, which I think is a good starting point, but it is always very much a backward-looking reaction that you're putting into place today. And I think right now the discussion really is, how do we make sure that we get nutritional food affordably to everybody, right? What we specifically have been looking at is more market linkages. So to a certain degree, what we do see is that e-commerce and direct procurement from farmers is helping at least support farmers in their livelihood a little bit more. But that clearly is more focused towards, if you like, the middle income area, where already the nutritional challenge is not so big. So it is upon us really to say, okay, how do we do two things? One is obviously really deal in this crisis and help people that are needy right now. But how do we take this also as a potential opportunity to rethink more consistent and sustainable supply of nutritious food also to the very needy? And with that, I would like to hand over maybe to the next panelist. Thank you very much for giving me the opportunity, and I look forward to the questions later.
Thank you so much, Simon, for your important insights, and be sure we'd love to hear from you now.
Thank you very much. I think it's really a good opportunity to have this conversation around nutrition, because it deals with children, it deals with the poor people, and it's about human development of India, and it's about a new generation. So therefore, it's absolutely very crucial. So I want to really compliment Global Compact for leading this conversation. Why nutrition is important? The reason it's so important is also that it's about, at the earliest stage of a child, you need a good nutritive food so the brain development takes place, and you have a good potential for the future. And also the huge concern in India is the rise in child death at early stages because of malnutrition. And furthermore, the concern is economically. Investment in nutrition is worthwhile economically, and it has a huge return going forward. Coming to India, the big concern we have and challenging situation is as we just heard from Simon, we have a very high level of stunting and the concern of malnutrition. And therefore, given that situation, to be aware of and address that issue upfront and respond and prepare is really critical. And as Kamal touched on, the whole issue of SDG 2, hunger, and it boils down across several SDGs, and therefore it's an important element to touch on. In the context of India, why does India have such a high level of malnutrition? The situation is that India has so much plenty. Actually, it has reached self-sufficiency, and also the government is investing so much money and resources, and there are several programs targeting the issue. But still, there are challenges in terms of malnutrition because malnutrition is a factor of food self-sufficiency, not just the rice and the bread, but also vegetables, minerals, vitamins, composite of that. And there has been a serious concern that part has been really deficit in India, and also there are problem of health, diarrhea, shortage of water issues, and lastly also concern about the social behavior, the knowledge among mothers in terms of a diversified food need, etc. And finally, the attribution of malnutrition in children is a factor of how is the mother, how has been her weight, how has she been during the pregnancy, and then soon after pregnancy, when the child starts eating food and how healthy, etc. The whole concept of 1,000 days. Therefore, these factors are being further aggravated by the whole COVID situation. Indeed, there are various programs which are there, such as the full ICDS program, where the children are provided with nutritive food, the mothers are taught, and these are special intervention for about 100 million beneficiaries. It's a huge instant, intervention and program. Second is the whole school lunch program, midday meal. It covers 120 million students in elementary and middle school. And then there is the huge program of TPDS, where the close to 800 million people are receiving food support. Unfortunately, the challenge has been is because the lockdown and also this COVID and social distancing, some of the regular access to these have been threatened. Although I must applaud, the government has come out with a really great initiative, delivering food to the houses, providing cash to the students, and the huge program from the government to increase food ration, doubling it in the last 3 months, and then now further increase by additional 2 months, including provision of pulses and etc. These have been great measures, but there have been some challenges. For example, the whole TPDS system is based on access to certain ration cards, and then you have that you are on that list, etc. And there have been challenges at the early stages, many people not getting food rations, but I must say the states have brought out an intervention and have introduced a measure that everyone who comes or everyone who is poor needing would get it, irrespective of they have a this public distribution ration card or not. And lately they have introduced this EPOS, One Nation, One Card system, which is a really great innovative approach. But then this is the food part of it. But there are the other parts in terms of the water and sanitation, the health system. They've been all disrupted, and the livelihood through which people buy food, and that have been disrupted because of the factories closed down, the job loss, and because of this COVID, and it has all threatened the system which existed in the past, in spite of great efforts and etc. So we believe with partnership with societies, with communities, and advocacy, and including engagement with the private sectors, we can bring a difference. The United Nations World Food Program, we have been extensively engaged in a number of ways, in our own little way, to support in this process. We have been bringing innovative tools, application to bring farmers to the market, so the market have access to fruits, vegetables, those things. We are also introducing technology to improve system, such as like the supply chain is improved, and also we've been working on the EPOS system. The whole issue of fortification of food commodities, so that there is a improved balanced diet, and those things we are working on. And also we have been linking very closely with this Empower group, and providing real-time information and flagging out issues to support government in terms of various direct interventions. So there are challenges, there are big efforts, but I think going forward we still need to do a few more things, and we must pay attention to the nutrition issue. Yesterday only this global nutrition report was issued, and they are telling us that we may be at a threat in achieving nutrition target by 2025. And there the target was reducing stunting by 40% for under 5, reducing prevalence of anemia for 19 to 49 by 50%, and ensuring 30% reduction in the birth weight as well as overweight issues, including the whole issue of wasting reduction for under 5, and breastfeeding. These like 5 areas. So we have a threat, but we still have the time. I think what we need to do is redouble our efforts, working together, and the communities, individuals, private sector, civil societies. We all have a role to play to complement government efforts, and they are putting a huge investment. But what we need to do is support in that process. So thank you very much indeed.
Very, very much, Bisho. I think, you've really outlined some of the very foundational issues, I think, when we talk about nutrition among children, malnutrition setting in at a very early age, and all of that getting accentuated by and during COVID. So thank you very much for your insights. Over now to Piyush. We would love to hear your insights on nutrition in the context of COVID. Over to you.
Good evening, and thank you for inviting me as a speaker to this webinar. Actually, this subject is very close to our heart because for Cargill, this echoes with our mission of nourishing the world. One interesting thing, of course, is to speak after two such distinguished speakers is that I have to echo a lot of points that they have said, so I'm going to skip most of it and focus on two parts of the discussion. One, I think this is absolutely at the core of a humanitarian crisis that we are currently facing. More than a virus infection or pandemic, this is manifesting in a big humanitarian crisis. And that, in a sense, also reflects some of the points which Vishwa was talking about in terms of underprivileged sections of the society and children below a certain age who are facing impacts of malnutrition. I think this, if I split it as a corporate participant, if I split it into two parts, I see it, as an issue of knowledge or information dissemination and making sure that it is available. The information is available, and the second part is availability and scalability of nutrition elements, whether it is nutrition inputs to children or it is nutritious food or it's fortification of commodities. That we are all attempting to do. I think for Cargill, this is at bang in the center of what we do. We are a company which provides an essential service to the world, delivering food, feed, and ingredients to the larger world. And for us, this has been a real test of our core values, because what we do is that we play a critical role, as is the case with many players in the world and some of the other co-participants, is to manage the continuity of the food supply chain. And one thing that has happened good is within this crisis, the global food supply chain has been intact, and it also, in a sense, proves the dependability on the global food supply chain. In a long way, this is the baseline. This is the framework. This is the frame on which we're going to build the nutrition delivery mechanism. And there are two parts to it as a private sector participant that I see. Is one is, for us, the core value is putting people first. And this extends from beyond our own closed loop systems to extended communities that we live in. And we are absolutely exhibiting that as a company. And I'm seeing many of my peer group companies in the agri and food sector who are doing the similar stuff by delivering food stuff, delivering a lot of relief work in the communities that we live in. One of the core things that we have to look at is obviously there are elements of corporate social responsibility work that corporates are doing that has a scale, that has an application, that has an impact level, which is obviously in a smaller frame. But there are commercial enterprises which have a role where the job of nutrition can be done in a way that it benefits the overall agri and food value chain and eventually creates value in terms of commercial value for all the participants. In that way, a lot of that value percolates back to all the participants, whether it's the farmer at the farm pit stop or it is participants at the aggregation mandi level. So it's eventually a lot of value that's created. So the 2 points that I want to echo out loud is that this is absolutely in the center of what we need to do as both corporates and global policymakers and governments, and some of it is already happening. The second part is that as much as availability of foodstuff and nutrition supplements is important, so is the availability of information and certain level of education for players that is important. One of the most interesting things that I wanted to talk about is something that we're doing with the World Food Program in the Jaisalmer district in Rajasthan. There's a small program that we are doing, but obviously it's much bigger scope, is trying to actually impact a certain section of the population for better quality nutrition. And what we are doing is, one, we are disseminating more amount of knowledge and information about the nutrition requirements, and also focusing on a certain segment of the younger population between 6 to 36 months of age, which obviously is the age where it has a critical impact in terms of overall. I think this is just one example, but then across India, there are hundreds of such things which are happening. And I just want to end with my opening remarks with one point, that there is never going to be enough of this. At some point of time, there is always a hungry child, and as long as we have one such impacted child, we need to make sure that all of us are connecting hands, both as policymakers and facilitators who can reach that last person standing in the line to help. Thank you.
Thank you so much, Piyush. And I think I take away your last statement about a collective. Really, it is. And I think all three of you have at different points in time mentioned the power of a collective, the power of coming together. And I think in times such as these, or even others, this is really what works. So thank you so much, all of you, for your insights. And now to get deeper into this discussion a little bit, I'm just going to have share some of the questions with you. So I'd like to start with Simon. And there are, of course, as we've heard from you and from the other speakers, the short-term, the long-term impact of COVID-19 is going to have on access to nutrition. I think we've discussed that and heard about that. So, if you could share with us, what are some of the challenges that you think need to be prepared for, that we collectively need to be prepared for?
Yeah, I think we need to see this as a may I call it a situation shifting crisis. Yeah, I remember, especially at the beginning, there was a lot of economic talk around, is this a V-shaped or is it a U-shaped or is it an L-shaped economic recovery? I think actually you're going to be seeing in some areas there is literally a pre and a post-COVID situation, and that means when we look at India, what we at this point believe is a lot of the migrant workers will actually not come back. Now this might have also some good to it. I tend to be saying, in India, when it gets really bad, people go farming. And that is a little bit what we're observing at this point. What is important here is to now a little bit also to Piyush's point, yeah, let's say shift the communication and work more together. A lot of what I've seen my team do is talk about safety at this point. Yeah, how to implement social distancing, how to use masks, how to avoid unnecessary contacts. It's quite interesting. You would think very simple things, and these are highly appreciated out there. To that, I take already now out of our discussion here, we should talk much more about nutrition and especially how to feed your children early. And honestly, these are learnings we're taking along the way. I think a lot of the may I say also criticism of the private sector in the past has been they go somewhere, they sell something and they walk away. And I hope that in many ways you will have seen that this has changed already. What is really making us rethink right now during this crisis is that we actually can give much more valuable education out there and much broader education than we might have thought about so far. And literally this is where a lot of efforts go in. And I mean, I tell you honestly, I couldn't be more proud of our team. We have people, I mean, I get pictures coming in, we call them our buyer heroes, how they're literally feeding the people around them, yeah, where we've had, we opened up a big kitchen with Mahiko a couple of months back for children, for schools, right? And we were so proud to be doing that for school children. Guess what? Right now they're feeding migrant laborers that were caught up there, and you sit there and you say, wow, you can make a difference, but important is you do it in conjunction with everybody else. And I mean, just looking at Piyush, I think we have a lot of touching points between Bayer and Cargill. If we agree, and maybe Bishop, you can help us on what would be some basic basic nutritional education that we should get across without our marketing activities, already these two companies will be touching. I touch 100,000 farmers a day. We talk to 1 lakh farmers a day. Yeah? Gives us a huge opportunity to speak out into the affected, poor parts of the country, and spread that education. So this is maybe already a commitment that I would give here. If the World Food Program would help us with a couple of statements here, I'll happily take them up. Thank you.
Thank you so much, Simon. And I think that's so connected to, a very quick insight that I'm going to share around, the impact for nutrition. And as Kamal ji was mentioning right at the start, I, wanted to highlight that in the context of the role of the private sector, and just as you rightly said, how the role has evolved and how the role has actually grown in the case of COVID, and how you've seen it happen, and how encouraging and inspiring it is for you to see, your own workforce move into areas and support in the manner that they are, and also as Piyush was mentioning, and really that was the foundation of Impact for Nutrition, which is a private sector platform incubated by UNICEF and with multiple partners, including the Tata Trust, Sight and Life, CSR Box, CII, NASCOM, the UN Global Compact, who are key partners. And I think the idea really to set up this platform was exactly the points that you made to get, and we've got more than about 55 companies who are partners in this, private sector companies, and really the idea was to share information, to share knowledge, to be able to focus on developing content for nutrition literacy awareness programs at corporate and community levels, providing tools to CSR heads, HR heads around workforce engagement, and also seeing how they can use their specific business environment to promote good nutrition. And already we have, as the Secretariat, ready to use, implement employee engagement and volunteering packages at the workplace, but also CSR community-based outreach packages, which a number of companies are actually using, especially in the context of COVID. So there is a special package which has been created for times of COVID. So we will be very happy to share that with you, and also see how, like you rightly said, the need of the hour really is to exchange and to share and to get good practices across, where this becomes an encouragement for many others. So thank you for sharing. I would like to move on to Bisho, and with the question around malnutrition, and malnutrition and access to nutrition have obviously become they have been a long time concern in India, yes, but in the context of COVID-19, this has amplified the crisis. So when you were speaking, it would be great to hear some of your thoughts on how we could actually protect the most vulnerable, especially women and children, from the effects of this nutritional crisis.
Thank you very much. I think I want to first appreciate, of course, I was going to refer about our cooperation between Cargill and World Food Program, but thank you, Piyush, you're sharing that already, and we hope to set a great example there to multiply to other states through that example. And also, I want to welcome Simon's offer. In fact, there are multiple opportunities where we could really link up. We have, for example, cooperation with Ericsson, on technological advancement. We have cooperation with a number of other private sectors as well. And I think, the TPDS program covers 800 million households. People, 800 million people. You can imagine the outreach can be done through multiple ways to help address some of these concerns. Now, coming to the issue of malnutrition and access to malnutrition, and how do we look at this maybe differently or repackage it in the context of these COVID? Few thoughts come to my mind. One is indeed, one of the major factor in terms of the concern of malnutrition is absence of adequate food itself, as is straightforward. The household, individuals not getting adequate either rice or wheat, plus they have no protein and vegetables and those to complement that part of it. So we really need to make sure that they have that. Now, just to give you an example, I mean, government introduced these extra pulses for this, COVID period to distribute. Hardly 35% were able to get it, unfortunately, because there was a supply chain disruption. They were not able to really quickly deliver that. And then the second point is diversification. I think in the whole context of food diversification and access, the issue of poverty and income. Now, with the current COVID, people have lost job, they are back into their villages and etc. So we need to do multiple things. We need to teach them how to grow maybe vegetables at home, or also have cash in the hand of mothers and etc. So they can buy vegetables, fruits and etc. to support it. And finally, what is also important in the broad context of this is and that's where the private sector engagement can come in, fortification and access to nutritive food. I go to supermarket in Big Bazaar and I see a mill there, right there, the varieties of beans or wheat, they can just blend you and then and you can have it, for example. If we were able to sort of bring cheap local varieties of multiple varieties of dal and pulses, and further for mothers to be able to cook that, if we're able to communicate and pass that knowledge, and then if there would be a possibility to add on certain amount of vitamin and mineral into that, really that's what it takes going forward. We have a number of state welfare program in partnership with a number of private sectors have introduced these modalities, and the government has taken over and expanded it. So there is that possibilities exist, and of course, the biggest challenge now in the current context is the income and the people's ability to buy things and procure. And now with the job loss and migrants going back to these villages, there is that huge added challenge for, I mean, we have already been hearing, rise in gender-based violence because tensions, etc., even at the household level. So we need a multiple approach to really reach out to the most vulnerable and poorest communities, especially children and women, and see how best we could reach that. Now, there is this number of programs, I stated the government programs are there. Maybe there should be a special additional element of support in addition to those programs, helping stabilize the nutrition. Now, in the last 2-3 months, the vulnerability has added on, increased on certain populations. So we need to help them to come back to the previous level, even going forward, and then prevent further deterioration and also improve from the stage it was pre-COVID. So we need a multiple partnership. We need to mobilize communities. We need to all join forces with the private sector. Media can also play a very important role to communicate, educate, and reach out to these communities. But it's doable. I mean, and because the investment India is making in all this effort is enormous. I think the biggest thing is there is a policy commitment, financial commitment, and there are programs. So we just need to make sure that it reaches to the right target groups, and reaches in the way that it can make a impact. And lastly, the point is, as I said before, I think nutrition is a factor of health, is a factor of water and sanitation. So we need to make sure that these other programs which are there are also there for these most vulnerable group of people and communities, so they have access to water, good drinking water, or sanitation facilities. So with this, I believe that there can be a really improvement made, and we can challenge the whole status quo and have a much better nutrition situation going forward.
Thank you. And, as also, thank you so much. I think, all your insights are critical. And also, I'd just like to make a quick mention of, as you had earlier mentioned, this linkage to WASH and to health practices, health behaviors, and also what I think Piyush was mentioning in terms of communication of key practices are very crucial at this time. So when we think about also especially the most vulnerable women and children, and the effects on them, simple basic practices like breastfeeding, and those are things that and other such behaviors have to be spoken about, have to be communicated in order to ensure that we remain with the core essence and practices of nutrition. So thank you so much. I'd move on to our next question, and that is to Piyush from Kargil. So, what role do you think that we have been discussing, but it'll be good, and you already mentioned some examples, Piyush, you did, in terms of the private sector's role to play, to improve access to nutrition and address the challenges of malnutrition, not just during COVID-19, but also beyond. I think you did address some of this, giving some very key examples also of programs that you have in different states and in partnership with WFP. But it would be great to also hear your views on, your supply chain, the private sector supply chain per se. How can they play a significant role in this? Over to you, Piyush.
Before I start that question, I just wanted to respond to what Bisho was saying, and I completely echo the point that you mentioned about fruits and vegetables growing and how we can actually teach farmers and in localized ways. Just to give an example, Kargil is currently actually working with 5,000 women farmers in Karnataka, in the district of Davangere, to help educate how you can grow in your backyard, in your kitchen gardens, fruits and vegetables, which is both an income and also helps in adding back that beyond cereals to their food plate. I think that's we are doing it 5,000. Why it can't be 5 million or 50 million is a question that I completely echo what Simon was saying, that as a collective there is a possibility to scale up something like that beyond a few thousands to few millions. So it's clearly scalable and impact creating. So I think to the question that you asked, I see the role in three fronts. One is what the companies are doing in the space of corporate social responsibility for nutrition. The second part is what companies are doing across the value chain as a commercial enterprise, which is eventually impacting the nutrition both on the availability side and also on the information, the knowledge dissemination side. And the third part, which is the baseline, which makes everything viable, is what a company is doing in the space of sustainability to make sure that the overall thing it stays there. I'm not going to talk a lot about the CSR piece. I think a lot has been spoken about it, and companies also talk a lot about it. I want to talk about the second one, and I'm going to frame it narrowly and say India has about, give or take, about 140 million farmers, right? Huge population, huge impacted part of the population, and if you add the families and you add the communities that they live in, it's multiplied. Now, I look at it that as a company and as corporates, we have a huge role to play in how do we carry impact back to the overall farming value chain. And I'm just going to give a few examples. I'm not going to talk about a lot of it, but the way we manage wastage, what role corporates can play, the way we manage wastage, the way we do farmhead processing, the way we can really bring in technology services, some of it companies like Bayer are already doing in the space of input and other inputs, agro-industrial clusters that can happen in districts. When you do all of these activities together, it creates significant value, and some of it percolates back to that 140 million impacted families. That's huge. I think the point that Bishu mentioned, that eventually baseline nutrition is about availability of food and availability of nutritious food to the population. I think this is one section in which corporates can really impact. The third part on which I think is significantly important is the sustainability piece, both human sustainability and also environmental sustainability. And to me and to Cargill as a whole, that's absolutely important, because all the work that corporates do across the supply chain and all the work that all of us do in this space to impact livelihoods, impact nutrition, needs to be viable in the long run. And for it to be viable and to be available to the most vulnerable parts of the communities, we have to make it broadly inclusive. And that, to me, is the core of sustainability practices that's being advocated by the United Nations and also being advocated across the world by scientists now. So from that point of view, I see it as that. If I sum it up, what corporates really bring, corporates bring a certain set of skill set and program management, the ability to really scale up capital, and most importantly in the current frame of things is technology. Not just the physical technology, but also digital technology to connect back and make sure that there is information dissemination and there also connectivity across the overall food value chain to make sure that there is value being transferred across the nodes. So that I think is what I would put as the role of the private sector. Obviously, different companies pick up different parts of these three elements and amplify their own actions around it.
The takeaway really is sustainability, and I think there has to be alignment there, because really everything has to be rooted in that. Moving on to Simon, I'll come next to you. Since we're talking about the private sector and we're talking about, and Piyush just mentioned three very critical pieces, including capital, technology, skills. Could you share with us some sort of good practices that you're of how your offices, you did mention something about your some of the interventions that are taking place, which are rather motivating to listen to, and it would be great to hear if you could share maybe with us one or two good practices in other countries where how they have actually secured food and nutrition supply chain during this pandemic.
Yeah, I think what is extremely important to realize is that the scale of the challenge is significantly bigger in India than in most other countries of the world. I like the example China a little bit because it's gone through it and people were also talking about huge migration. But when you think of it, they were talking about a holiday. This was Chinese New Year. This has nothing to do with shifts of people that potentially, as I was saying, the migrant laborers might not be coming back. Having said that, important is that the interventions that you take should be targeted at becoming sustainable, at changing habits. I like to use the phrase, give a man a fish, you'll feed him for a day. Teach him to fish, you feed him for a lifetime. And I think this is where, in many ways, the focus must lie. So we have a very nice example in Chhattisgarh where last year we actually gave away hybrid rice seeds for free. But we did that with the intention to really build an ecosystem around it and understand what impact does it make to people. And we would be seeing increase of income in the range of 70–80% on average. And it gave us the opportunity really to interlink this with CSR activities, with water availability, with bringing in new technology. And I think this is what is important. And it is unique. Something very unique to India is that there is the compulsory CSR funding. And I think some of us in the past have struggled a little bit and used CSR funding, sorry to say, often for quick impact, high visibility activities, but not necessarily something that would build capability and sustainably change the way things are done. And I believe this is really where it comes down to. While right now we need to solve the immediate concerns, we should always ask ourselves, can we take interventions at this point that will actually lead to a change in behavior, and with that sustainably improve the situation? And that would be my focal point for everything that we do right now. Let's use, and it's stupid, but let's use this crisis literally as an opportunity to rethink any and all approaches that we take, and how can we make that much more a beneficial impact on the people that we interact with, and with that improve the situation in the country for good.
Yeah, thank you, Simon. I think really it's always been about, the software and the hardware that people talk about, that, can we build things quickly, can we put out things related to CSR, which can be seen. But I think really, however many things you have, or schools you build, or wash stations you have, the essence of it is how people are going to use them. Are they tuned? Is the behavior? Are the practices? Is there understanding so core that they believe in something like this is going to improve their lives? So I think really, if we are able to link that CSR piece, as you're rightly mentioning, it can make so much difference, invested in the right longer term initiatives, which will really make a difference to people's lives at the core. So thank you for that. And I will, would like to ask my second question to Bisho. In the context of the government's current plans around COVID-19 response plans across areas, and I'm asking you specifically this because you so rightly mentioned that nutrition is not standalone. It's very much linked to WASH, it's linked to health, it's linked to the larger response plans which are there. So what would your recommendations be as a collective to the government on how to actually include and ensure access to nutrition in these plans, specifically from the lens of the last mile, reaching the last mile with good nutrition?
I think that's a very, very important question. At the end of the day, what we do today makes a difference for tomorrow, correct? So action we are looking at. The first good thing is about the commitment of the government. I think there is a strong commitment of the government. They have already brought a third or fourth stimulus, starting from direct relief, food support, and an increase of that again further. Then there are various packages to different groups of beneficiaries, including farmers, smallholder, etc. So I have like 5 points recommendation I have going forward in that. The first point I want to say is, given this huge challenge of movement of 60 to 80 million migrants back to village, losing jobs and etc., I'm not sure they are ready to recover, to have full access of their food through their own income. So although the government has now extended for 2 more months, and then I don't know if all these people are in the list of these ration cards. So I would say include everyone who needs help. Don't limit to the ration cards for the next 2-3 months. And then it may be that needs to be extended beyond 2 months, depending on how the situation evolves. So we need to make sure that they have enough food to eat. That's number one. And then number two, I would suggest is diversification of the food. Because a lot of times, sadly, also, the women and children, women in particular, eat the last. And unfortunately, that's evidence. We have done a survey, World Food Program, we have found that. So we need to make sure that there is enough at home, so there is enough left also for women to eat at the end of the day, and those most vulnerable one, and etc. And then the diversification. diversification in the food basket. Now there is the rice and then the wheat, but what's about pulses? I think the amount of pulses available should be adequate. The last distribution of pulses, as I was saying before, was not even adequately accessible and thus delivered. Whatever delivered to the states was distributed. So it's really important to have that diversification, food diversification. I would urge an inclusion of cash to the household, to the woman, in the woman's hands, so they can buy it. That can also help multiply the local economy because the markets, and that will generate potential for people to grow, and given all these closure of the economy, it will really help push that further. The third point I would say is, there are these programs, Manrega and others, job employment programs, to create job for the youth, unemployed, those who have come. I'm very glad to hear there is more budget has been put into that. Now here is an opportunity to really engage those into activities such as rural infrastructure or afforestation, environment program. And I would say maybe there is also an opportunity to extend that through like food for assets type of program. Provide food to the people while they're working on communities and etc. if there is not enough cash. So we extend the scale of employment even more, and then have some technical knowledge brought into that, so you have a quality work. If there is a rural infrastructure done, then, because World Food Program began 50 years back with the cooperation of the government of India, we have a massive program of afforestation. We had a massive program of rural employment, and there is a history, and there is a good prospect to do that. That's number 3. And number 4, I would say, is let us continue to monitor the situation. In the worst of states and districts, so there is understanding of what's happening, and then interjection of support is possible. Surveillance. UNICEF does a fantastic job in nutrition surveillance work. It was done some time back. I think it doesn't have to be a comprehensive survey, but a spot level work that will really help understand what's happening on the ground. And then also the 5th point I would say is the partnership with civil societies, engagement of volunteer, women self-help group, etc. I think they have demonstrated a fantastic cooperation in the last 2-3 months in terms of volunteering, kitchen, community kitchen, distribution of food, reaching out, and etc. Let's continue to engage that part of the society. That also adds value. It reinforces comradeship, an element of engagement of community into that process. And finally, I would say, broader partnership among civil societies, private sector, UN organizations, and then integrate other programs, the health program, water sanitation program, into these food system or nutrition system, what we are trying to look at it, and add value from these 3 major programs which government is supporting, the TPDS, midday meal, and ICDS, so that the impact of these is maximized. And of course, the initiative which the government has taken about EPOS, like one nation, one card. I think these are fantastic initiatives to speed up, to have that realized. These are a few thoughts I would put forward. Thank you.
Thank you so much, Bisho. So it's always so effective to have 5 points, 3 points. I think you mentioned enough food for everyone, diversification of food, what is in the food basket. It has to be holistic. The young people, jobs, and opportunities for them, surveillance, and of course, as we started off our discussion, a collective, how we can make this a movement, how we can come together as a broader partners. So thank you so much for that. Moving on to actually my question, actually the last question, given the time that we have, and then we move on to some questions from the audience. Piyush, this one's for you. Could you highlight to us how there can be linkages made between farmers to markets and customers with sustainable nutrition solutions in times of crisis like today and beyond? So just those, you already did mention that, bringing technology, bringing information to farmers, but if you could give a little bit more insight on this, please.
I think it's a very interesting question. Technology is obviously a very big part of how you connect back the farming community to the marketplace. But I just want to lay out, the point that we talked about in our food basket diversification, and the fact that if you look at Indian farming, obviously it's very cereal heavy, right? So the quantum of food grains that we produce versus what we actually need for other food sites, the ratio is obviously skewed. The way we think about it, and something which the government also has been very receptive to in our discussions, and I really echo what Vishwa was saying, that the government has done a lot of work in the recent past in this space. Two points to talk about. One is beyond the baseline cereals, there is a need to identify what are the emerging needs from the consumer side, from the consumption side. There's a lot of talk around healthier food, wellness ingredients, diversification of the food basket, protein, etc., etc. So beyond the crops, is there a place possible for the way we look at animal husbandry, how we look at dairy, poultry, etc. So that's one big element. And many organizations are doing a lot of work around that space. Government is also facilitating it. We, of course, are doing something in this space with Hatching Hope with IFAR International, so in the state of Orissa. So that's one piece, identification of what the consumers need. And use technology, use policy frames, use clusterings to essentially connect it back to farmers in a sustainable, scalable, and most importantly, in a commercially viable way. I'll pick a couple of examples just to talk about it. I'll not take long. A couple of examples. One is around the space of organics, right? Obviously, it's a very, very niche space. The farmers produce drops because of various reasons, and the income actually can get impacted unless there is an ecosystem which is built around this entire space, and this then builds back in terms of how we want to look at that entire health need that people are talking about. A very simpler example is the space of millets, something which was available, something which was very, very popular, but then got faded out, and obviously has come back as complex carbohydrate requirements have gone up and fiber-rich food requirement has gone up. Millets are finding a new space, and similar stuff around plant proteins. Now, how many of these can really flow back into the farming supply chain and become sustainable, scalable things, which can then, in a commercially viable way, can be connected back? So, enabler, obviously, it's technology. Enabler to make it commercially viable, and eventually link back the emerging consumption needs back to the farm in a more sustainable way. Couple of things which have happened and is going to help is obviously this recent policy announcement that the government has done in the agri-reform space. The fact that we are currently moving beyond the APMCs in terms of the transaction is definitely a big space. The ability of farmers to directly trade with big retailers and corporates is going to help, and the ability of corporates to also grow in a combined way to some select clusters is another fantastic help. Public-private partnership around the space of food storage is something that is already happening and will go up. and in a very big way. Yeah, and the technology space, couple of very quick examples. The way blockchain is getting used for certification of origin and certification of genuineness of a particular product. So that's one thing which is very good. The way artificial intelligence and machine learning is used to certify the quality of the product just by looking at pictures. So there's interesting work happening across all of these elements, and I think in a composite way, the policy framework is getting evolved very beautifully. The current agri reforms are setting pace, and when you talk to the government, there is very clearly more in the offering in terms of opening up and allowing the connecting of this farm to the table and farm to the consumption centers. So what will happen is, based on this policy framework and the technology evolution, I think it will get faster connected. The job of corporate and the job of government would be to facilitate the connection back from the emerging consumption points to the originations and the growing community.
Right. Thank you so much, Piyush. With these insights, I think would also give a lot of you know, the larger universe who's listening in, but also with who the proceeds of this conversation are going to be shared, to start engaging in the areas that you've rightly mentioned. And I think technology being a critical enabler, and also linking to emerging consumption needs. So thank you for that. I will now move on to questions from the audience. We have Shreya, who's actually provided me with some of the questions. So I'd like to move on to them since we have a few minutes left. I would like to put this up to possibly any of the panelists. How can we leverage on the strength of volunteerism in our country, specifically for tackling nutrition issues? Maybe I think, Simon, if you could share this, you had given an example in a, you know, when you were defining what activation is happening at Bayer. So how do you think this can actually transcend into larger volunteerism in our country for tackling nutrition?
Yeah, I think it's partly to do with making it simple, right? This is a little bit why I was looking at Bischoff as well. If you can somehow make it almost a habit to say, whenever you interact with potentially underserved sectors of the country, to add in, at this point, obviously, some advice on safety and COVID, but just as well some advice on nutrition, it is, I think, going to make a significant difference. There is a lot of economic activity also happening in the hinterlands of the country. And I mean, volunteerism is definitely great, no question. The question for me is sometimes the sustainability around it. When you go out now and say, does somebody want to help fight the COVID crisis, you get a lot of people saying yes, as long as I don't need to leave my house, because they're afraid to attract the virus themselves. So I think it's a bit more to do with really asking yourselves, and especially those which do deal in the non-urban areas of the country, and that literally is us who deal in agriculture, to think a little bit broader about how we approach the topic of nutrition. I think that's for me, at least, again, the takeaway.
Bishu, I just wanted to ask you if you wanted to add any insight on this.
Yes, thank you. You know, I began my career as a volunteer for 2 years. Why did I volunteer? And the opportunity, why are the youth looking for that opportunity? It's self-motivating. For young people, it leaves the foundation to start your new life. So it's a win-win for the community as well as for that individuals. And I think what we are talking here in the context of nutrition is a basic education element. It's a communication. It's not rocket science, really that sophisticated specialized language. So I think there is a huge, enormous scope. And also historically, India is rich from that, you know, helping others, helping neighbors, helping society. India has that deep-rooted culture. I think creating that opportunity is fantastic. In fact, I did run a program in Indonesia, in the slum of Indonesia, nutrition program. It's about 15, 20 years back. We had 500,000 mothers, and then we mobilized youth university students, and we had an NGO who gave the space for the university students to come and work during their holidays and then on weekends. So we just need to create a platform, but I believe there's enormous scope to engage volunteers and support in this area.
Thank you so much, Bisho, and it's really it's inspiring, I think, to hear you, and also to millions of sort of young people out there, because you're so right. I think there's always that fire, that desire to be able to connect and to do. And I think if there are some base opportunities created, they start thinking in that direction, which can be extremely encouraging for them. So thank you for that insight. And also thank you, Simon, for your thoughts on this. So one of the questions, and maybe, Piyush could share this with you. How can companies help the government and related agencies in tackling the supply chain issues to solve storage, distribution issues of perishable produce and related and other pieces within the supply chain? So if you could share some insights there.
There are two parts to it in terms of what companies can do. One big part is obviously around the space of storage on the perishables. And I'm obviously talking about the non-dairy part of it, because dairy has obviously its own unique challenges. While storage has really expanded and there is more work happening on it, there is a lot of government incentivization around it. Public-private partnership is in a very clear way. It's a commercial enterprise which is expanding. But I must hasten to add that storage is a cost, and in some cases, these perishable products, in terms of value of it, because of the way we manage crops, go down to such a level at the farm gate level that the farmers don't even come back to collect the products that they have stored, right? And we have enough examples of that around potato and other stuff. I think that's one piece on which we need to figure out cheaper storage mechanism. And we were talking to some of my peer group business heads in different companies, and one of the ideas was that how do we really chill milk at the farm gate level? Because obviously a farmer which has 4 or 5 cows or buffaloes is not going to have a chiller. Because is there a possibility to create a 50-liter chiller, which is not really costing 50,000, 70,000 rupees, but a smaller unit? So that's something which really is an innovation, is a scale up that companies can do. How do we create micro storage and storage mechanisms which is helping, which is not expensive? So that's one piece, storage. The second piece, which I think is more powerful and which needs to get more help, we have it in clusters, but we need to have it at a far bigger element, is around this farm gate processing of agro produce, and do it in a circular loop so that the overall system can impact. When you look at a product value chain, we typically have it so fragmented that that by the time we have scale, it's not connecting back to the place of origin at the farm. So if you look at a cotton farming to textile industry as an agro-industrial complex, and create those clusters, and we have enough examples globally of such things being created in different parts of the world, how does that really go back and create a circular economy? And it really gives back to the place at which the origination is done, but it also captures a significant value addition, and we can actually do in some of those industries at a globally competitive scale and become exporters and become centers of excellence and points of excellence. So two parts. One is around storage, which is obviously done at a macro level. How do we bring it down to a micro storage? And second bit is that how do we do a clusters of overall value chain and do it in a consolidated loop?
Bisho, I know, I see you'd like to add. Please do.
Yeah, if I may, I think we have a great example, a partnership between World Food Program and Ericsson here. In terms of exactly the point Piyush is referring in Uttarakhand, during this time of crisis, and we developed a number of new applications with the government of the state of Uttarakhand and connecting farmers to the market, and that really helped farmers to sell their vegetable and fruit and etc., and also the urban to have access to In fact, that's one of the area of big challenge we could really work on with private sector, with new technology. And exactly in the context of that also includes the storage element. But in a bit of a long term, one could also look at establishing cooperatives, commercial level of cooperatives, and also have a food processing element. So you add a greater value. There have been huge concerns, for example, flour producers losing their flours because no waiting, no hotels, they're not able to sell. There have been huge concern about also in certain area about vegetable farmers, including dairies, all these sort of problems. And I think by bringing this additional element of value chain, we can really support farmers to be more resilient and self-reliant. And also now with this new approach in terms of mandis, the government has introduced, the farmers are able to sell it. I think that gives them even a new opportunities to get maximum benefit. I hear that this new approach adds 20% to the value for a farmer. So it's a win-win for the farmer as well as the consumer, and you reduce that. So just a few examples. Thank you.
Thank you so much, Bisho. And I think that, we could actually continue this conversation. I personally feel very strongly about it, and I think it's interesting for all of us. But we have to, all good things come to an end, and I think so does this discussion now. We've got 5 minutes to go, and I'd like to now, invite Aseem from the UN Global Compact, yes, to end this session. Thank you, Aseem.
Thank you so much. I hope I am audible to all. First and foremost, I would like to thank the audience who on a Tuesday afternoon were with us, very curious, asking questions. Thank you so much. You are the very purpose of our existence. And we will take your feedback and come back with many more such initiatives. Now, it is my turn to thank all the partners and support providers to this wonderful session that we've just had. So let me thank Bayer, our co-partner, and also our support partners, World Food Program, UNICEF, and Impact for Nutrition. Without your support, this would not have been possible. Now, I must take this opportunity now particularly to thank our dear moderator and a personal friend, philosopher and guide. So she actually is very passionate about this subject, because we work with her at the Impact for Nutrition. And you could have all enjoyed the passion with which she was involved in the whole process. And that is the best example of somebody enlightening you and yet trying to learn at the same time. So hats off to you, Gitanjali, and we will continue our journey together. Coming to Simon, the distinguished panelist, and Bisho and Piyush, I think between the three of you, although we missed the participation of Dr. Arunachalam, who could not come out of the ministry meeting, but the three of you, like the Tradev in Indian mythology, you covered the length and breadth of the subject. And as Gitanjali rightly said, we feel we could have gone on and on. But since we have a timeline to follow, I take this moment to profusely thank each one of you for enlightening us and engaging us with not only the theoretical constructs, but also the practical aspects. From industry also, we got so much knowledge about the various elements of touching the lives of the farmers and the problem at the ground level, about supply chain and cold chain. And from Bisho, we got the overall picture, the big picture, where you not only look at supporting one part, but from one end to the other, it is our responsibility, duty, and privilege to be able to support this program. So without taking further time, I would once again thank you all the attendees, the moderator and the panelists, and also the team at socioladder, SustainEverse, and the team at GCNI led by Mr. Kamal Singh. It is his inspiration that we keep coming out with, initiative after initiative. He is a very hard taskmaster. And also with a promise that with the gentleman and the lady here, we will continue this to drive this movement, because we are committed. And I want to end by saying that together we can, and together we will. Thank you very much.